Morning, afternoon, and evening to all of our webinar attendees. Thank you so much for joining us for our annual International HPV Awareness Day, otherwise known as IHAD, for this high-level webinar on this, our 8th International HPV Awareness Day. My name is Joel Polewski. I'm Professor of Medicine and Infectious Diseases at the University of California, San Francisco. I'm the founder and chair of the IHAD campaign of the International Papillomavirus Society, IPVS. On behalf of the IPVS IHAD committee, I would like to extend a warm welcome to all of you attending this event. I'd like to say just a few words about the IHAD campaign before turning it over to our moderator, Ms. Karen Nakawala. Today, March 4th, is our 8th annual event. There are currently many excellent campaigns focused on specific HPV-related diseases, cervical cancer, head and neck cancer, anal cancer, but IPVS initiated this campaign to raise public awareness about HPV itself. We believe that it's important to help people understand more about the link between these diseases and HPV. Our goal ultimately is to destigmatize HPV infection, remind everyone that HPV is very common, that many different groups are affected, and that we can work together to reduce risk. By focusing on HPV, we can help people understand the value of HPV vaccination for primary prevention and the role, for example, of HPV detection for secondary prevention strategies. This campaign is designed to project positivity because we do indeed have much to celebrate. Our campaign theme, One Less Worry, is a reflection of this approach, but we still have so much more work to do. IHAD events are held around the world in conjunction with our now 150 global partner organizations, ranging from social media posts to TikTok dance challenges, seminars for healthcare providers, classes for the general public, rap songs, and many other activities worldwide. In helping to mount this campaign, I'd like to thank those partner organizations, our IPVS country ambassadors, the IHAD campaign committee, our campaign officer, Ms. Chris Amsinger, and our campaign manager, Ms. Anita Wiseman. This webinar is one of our key activities, and this year's theme is exploring the potential for inclusive approaches and the role of men in particular in promoting HPV awareness and alliance building between communities as a key strategy to reduce the impact of HPV-related cancer. Our panel today includes many distinguished speakers from around the world. They are Professor Margaret Stanley, OBE, Emeritus Professor of Epithelial Biology from the University of Cambridge in the UK. Margaret is known to everybody, is an internationally recognized researcher whose early work contributed to the understanding of HPV and cancer prevention. She's also an ardent advocate for what she calls an equal opportunity response to an equal opportunity virus. Dr. Ibtihil Fadil comes to us from the Eastern Mediterranean NCD Alliance in Bahrain. She will bring her expertise as a leader and health professional in the Middle East and North African region to our discussions, and her perspectives will help to spotlight the need for culturally appropriate approaches and the importance of male advocacy for HPV awareness in action. Dr. Devanshi Somaya from the Public Health Research Institute of India works with rural women in poor and traditionally underserved communities in Southwest India. She has experience in developing and engaging communities who lack access to information, developing services to help explore the balancing act between inclusive approaches and the prioritization of women's health. Dr. Mauricio Mazza is a regional cancer advisor from Pajo in El Salvador. He's a public health physician with extensive experience in the region, working on cancer and assisting countries with cervical cancer programs. He's a strong advocate for evidence-based policy and will contribute to our discussion on the evidence for alliance building and inclusive approaches to HPV cancer prevention. Dr. Andreas Njo comes to us from Cameroon. He's in Yaoundé. He's in charge of the Gender Neutral Vaccination, or GNV program. He's a doctor and epidemiologist and global health fellow with extensive experience in healthcare services in hard-to-reach and conflict settings. He headed up a program in Cameroon that took a strategic decision to test the impact of gender-neutral vaccination on community uptake. We'll hear more about that. As a panel speaker, he will share some key learning from that initiative and what it might mean for countries facing similar challenges with vaccine uptake in girls. Finally, our moderator today is Karen Nakawala from Zambia. She is a broadcaster, entrepreneur, cervical cancer survivor, and HPV advocate. She started a Facebook page with the hope of raising awareness about cervical cancer. and after her treatment founded the Teal Sisters Foundation, a member of the UICC. This foundation is responsible for screening of hundreds of women, including those in prisons. Karen has spoken in front of many august organizations, the WHO, the UN General Assembly. She sits on the WHO Living Guidelines Committee. She's a very passionate and strong advocate for cervical cancer elimination. So without further ado, I'd like to turn the discussion over to Karen. And perhaps, Karen, you could tell us why this is such an important topic to you. Thank you so much.
Thank you so very much, Joel, for that wonderful introduction. It sounds like a rap sheet, really. But I'm back to be back again for this session of the International HPV Awareness Day. And for me, this is particularly important because the cancer that I had is very closely related to HPV. And I always say that if I had had access to the HPV way back, HPV screening and even the vaccination, I probably wouldn't have gotten to where I am today. But well, that bridge came and we crossed it. And I'm hoping that when we're done with this session, the attendees are going to understand the linkages between HPV and some of the cancers, and that they'll also go away knowing that, you know what, there's something that can be done. And I think I'm particularly happy at the aspect of involving men in our discussions, because I think most of the time we discuss issues and we leave the men out, but at the end of the day, we expect them to support us. So I'm happy that that's what we're going to be looking at today. And so without much further ado, I'd like to welcome everyone, and I'll go straight into the questions. And this question is going to go to Margaret, and also Maurizio can weigh in after that. The HPV awareness and prevention has been closely coupled with cervical cancer elimination goals. What are the challenges and benefits of taking a more inclusive approach to HPV awareness that go beyond traditional sex and or gender frameworks? So I'll start with you, Margaret.
Well, you're right. The biggest challenge is in our mission statement, HPV affects everyone. It does indeed. And it doesn't discriminate, doesn't care whether you're male or female, doesn't care about your skin color, doesn't care about your lifestyle. It's a virus, it's got one objective, to infect you. And so it is an equal opportunities virus. And that means if you're infected, you have an equal chance of developing a disease, particularly in cancer. Now, we can actually prevent this by vaccination. We have fantastic vaccines. But our challenge is that in general, and I mean, I don't just mean people on the street, I mean health professionals don't recognize that this virus infects as many men as women. And if we're really going to be effective, we have to prevent infection of men and women, because that will actually not just remove, but pretty well eliminate the chance of getting one of these cancers caused by the vaccine. So the challenge is to communicate just how common this virus is, what it causes, the cancers it causes, the fact that it's men as well as women, and most importantly, that you can actually prevent it. And people worry about vaccines, but I have three messages about the HPV vaccine. First of all, you need it. You need it because there's so much disease about. Secondly, it works. It actually prevents cancers in the people who've been vaccinated. So far, we only know about cervix cancer, but undoubtedly, if we give this vaccine to as many adolescent girls as possible, you will reduce the cervix cancer in that group. But the third key thing is actually safe. And those are the three things. It works, we need it, it works, and it's safe. So I'll leave Maurizio to talk about the huge problems of trying to get that message across.
Oh, thank you so much, Margaret. And I mean, it's a great intro. And I think it's, you know, there's a lot of challenges, like you said, but fortunately, a lot of benefits that can counter when discussing a lot of the challenges, because we know that engaging men is something that, we've been working historically on HPV prevention focused mainly on women, right? Because of the cervical cancer. And now engaging men as part of the dialogue and advocacy, it's very important. And the great thing about that being first seen as a challenge is that there are so many benefits, like you said, and thinking about this as a comprehensive prevention approach is really important, because we know that if we do include men and clear up all the misperception or misinformation that could be around that HPV only affects women, highlights the importance of not only for cervical cancer and transmission and so forth, but the disease that affects men. And I think we've been working on cervical cancer HPV vaccination for a significant amount of time, but it took years to get, at least in the PAHO region, we have 48 out of the 51 countries and territories with the vaccination. And now we can start this conversation about who else can benefit out of this, because like you said, it's something that affects everyone, girls and boys, women and men. And I think, again, even though there's all these challenges about how we communicate and how we implement this, the benefits definitely, and that balance of challenge benefits will definitely support the work that we have to do when we communicate, when we reach out to men. And I think we'll talk a little bit more about this as we go through our conversations today. But more and more, we do see men involved in the decision making of and understanding the importance of including them as part of the solution, not only for cervical cancer, but more diseases beyond that.
Thank you so much. And my takeaway from the both of you is that HPV affects everyone. It's about men and women. It's not just about the women. But I think for the longest time, probably the message has weighed so heavily on the women, especially with regards to cervical cancer. And I suppose that's the message that we're supposed to be taking out. And then Margaret also said, look, we all need the HPV vaccine, and it works and it is safe. And I'm thinking if we can get the men on board, it's going to help us reduce most of the stigma that women suffer, especially when, like myself, who got cervical cancer, speaking, from experience. All right, so thank you so much. Moving on, this one is for you, Ibtihal. We know that around the world, awareness and understanding of HPV and cancer risks is very low. What are some of the most common misconceptions and misinformation around HPV in your region, and how do you see these impacting on health decision-making? How can taking an approach that goes beyond the traditional focus on women help us to address this? Ibtihal, this is for you.
Yes, thank you, Karen, and happy International HPV Awareness Day. We are in the Eastern Mediterranean region, despite the diversity of the country, but we have several common misconception and misinformation. To list some of them, one of the first one, which you already alluded to in your introduction, is the lack of information or lack of awareness between the link between HPV infection and the development of cancer. And also the lack of awareness that there is a vaccine available to prevent that cancer. Whether the cancer, HPV, whether the cancer among men and women, this lack of awareness and limited knowledge, unfortunately, is among healthcare professionals, among the community. Another area which is a challenge for us as a MENA coalition, a civil society working against to improve the situation in the region, one of the common is the stigma. HPV is always associated with sexual transmitted disease, and that make it very less in terms of seeking the information and seeking the knowledge about the disease. The area related to the vaccine itself, the safety of the vaccine. Many families are reluctant to introduce or give the vaccine to their children because they are worried about the safety on a long term of the vaccine, in addition to this hesitancy of taking the vaccine. Some countries in our region are having a very low incidence of cervical cancer. And the low incidence, this is a challenge, especially with the policymaker of introduction, any prevention measures, whether it is a vaccination or in terms of the screening. So you could see there is a commonality in terms of the misinformation and the misperception about the whole situation, which make it a huge challenge for government as well as for the civil society to work to improve the situation for the prevention of HPV in the region. Over to you.
Thank you so much. And the next question, just before I go to the next question, I think what I have picked up from you is the lack of awareness, which actually cuts across, including healthcare workers who don't really have that much knowledge about the HPV vaccine. And I think that is where we need sort of to increase the awareness and the education. Well, good luck to us trying to do that. But thank you so much for bringing that up, because we always assume that the healthcare workers know everything and they know better. Moving on to you, Andreas, you have some experience in working around low awareness and misperceptions in Cameroon. Can you describe how your approach to engaging with men and women helps to deliver progress in this area?
Yeah, thank you so much. I'm pleased to talk to you from Cameroon. And just to say that context, Cameroon, and we've been fighting to curb the spread of HPV for a couple of years now. And unfortunately, a lot of emphasis was posed on the girl child, the woman, cervical cancer. And we neglected the fact that HPV is spread and infects everybody. And so this created a lot of myth and distrust in the diseases. And when we observed it, got the men on board, keepers on board, and religious authorities. The first phase was really to inform them more about HPV and making everyone understand that it infects everyone and causes disease in everybody. And once they understood this message, they became advocates to the fight against HPV. They were the ones who joined us to sensitize the community, to engage the woman, and to accompany the adolescents to get vaccinated. I must highlight that we paid a lot of emphasis at the onset to vaccinating the girl child. But once we got boys also involved in the process, the table actually turned around, and the population realized this issue is not just about girls or women, but it's to protect our population. Thank you.
Thank you so much, Andreas. Your internet was cutting a bit, but I think we got the gist of your response. And the one thing I can say about what you're doing in Cameroon is that I think the messaging has been weighed heavily on vaccinating the girl child. And I think that is what has caused a lot of stigma and myths and misconceptions. Because I know in my country, they say that if you give a child the HPV vaccine, she will not be able to have children in the future. And so I always tell countries that haven't yet started vaccinating to include in the messages that this vaccination is actually safe for both boys and girls, and probably give the reasons why they're only able to vaccinate the girls. I think this is going to help us as we move forward with this agenda. Thank you very much. Okay, so I'm going to move to you, Devanshi. It's clear from what Ibtihal and Andreas are saying that, thank you. It's clear from what Ibtihal and Andreas are saying that men are important to all aspects of HPV cancer prevention. What are some of the strategies for engaging men that you have found successful when it comes to protecting the health of women that you work with?
So I agree with our panelists. Men are critical stakeholders in both HPV vaccination and cervical cancer screening. Their role spans multiple levels, from policymakers who are majority men, that's just the reality, to community and family decision makers. And engaging men in cervical cancer prevention is not just beneficial, it's a necessity at this point. So at the Public Health Research Institute of India, we're a private nonprofit in Mysore in southern India. When we talk to the men in our community, they often express a wide range of worries and apprehensions, which mandate an equally broad set of solutions. While some dismiss the topic as irrelevant, this is not the majority. If you dig deeper, you will find sometimes it's the fear of the unknown, sometimes it's a lack of perceived need. Some men worry about what happened to their loved ones if they screen positive. Many worry about economic implications, how to balance yet another challenge while managing so many different competing priorities. So, given these complexities, a cookie cutter, one size fits all engagement campaign really hasn't worked that well for us. We figure that we must meet men where they are and address the concerns, whatever they might be. If we approach them with judgment or bias, we risk alienating them and undermining our own cervical cancer prevention efforts. So to better understand stakeholder concerns, we used well-established research frameworks. For example, for vaccination, we apply the BESD framework. It's validated across multiple countries and cultures. It's endorsed by the WHO. And this model considers cognitive, emotional, and social influences on vaccine motivation, along with practical barriers like access and cost. Now, for screening, for cervical cancer screening, there's no singular framework that corresponds to that. So we have integrated two complementary frameworks or models. One is the theoretical domains framework, which helps assess individual and social determinants of health behaviors, although it does focus a little bit more on individual factors. Now, in rural communities, social norms play a huge role in health behavior. So to incorporate this, we also use the PEN3 model, which does consider broader social and cultural influences. Now, by combining frameworks like these, we analyze key determinants: knowledge, perceived risk, agency, anticipated consequences, social norms, all of these different factors that shape health-seeking behaviors. It allows us to create targeted, bite-sized awareness materials for all our stakeholders, including the men, tailored to our community's needs on their terms.
Well, thank you so much. What I'm already picking up is that I think in most regions we have the patriarchal kind of societies, and usually, you have these cultural norms and these nuances, and mostly these actually affect how women seek like treatment, how they can go for screening and things like that. But I love the idea that you brought on of actually engaging men, and not only at policy level, but I think right from the beginning. So thank you so much. Let's hear from Maurizio. And this time, I want to ask what you have seen in terms of successful engagement of men in HPV and cancer awareness in advocacy in Latin American countries.
Yeah, thank you. And it's a follow-up to what was discussed and what you just said, Karen, about the importance of putting all the stakeholders, decision makers to change the policies and really understand that this affects everyone, right? And how that has really helped the stigma around this. In our region, we've introduced, I believe I said it earlier, 48 out of the 51 countries and territories included HPV vaccination, but now 75% of those actually have included for males. So that is a significant shift. And we are also the region that probably has one of the highest coverages in the male population, almost 50% in some other countries. So, you know, looking into this vaccination programs in countries like Argentina and Brazil that have really included the boys in their national immunization schedules, public awareness campaigns. A lot of that we've also seen is through educational programs in schools and universities now targeting men. And this is something that I think it's really important to highlight. And every time we are in regional meetings, and Karen, you were in the forum and Cartagena, the global forum, and you know how men are involved in the way of really understanding how they are part of just not cervical cancer, right? But the importance for their overall health is and how that supports avoiding the stigma around just women and how men are involved with their, you know, when we have cases of survivors of cervical cancer and have their spouses being part of nonprofits that are helping change laws in countries are great examples of how men are being also involved as they are aware that this is something that affects, you know, everyone. So, you know, I think that's something that has changed significantly, which is then translated also as eloquently expressed into policy change, as expressed by others, and how that goes into policy change and the introduction of vaccination for male population too.
Thank you so much. And again, I pick up in the region the importance of vaccinating both girls and boys, and also involving the men. I think I don't know why we just think that men don't want to hear about some of these things, but you'll be shocked that when you actually engage them, I think it does change perceptions quite a bit. So I think it's important that we keep on engaging them. Thank you so much. Andreas, is there evidence that taking a more inclusive approach and developing more inclusive messaging has benefits for HPV and cancer prevention efforts?
Yes, of course, Karen. That is observation we have in Cameroon. And of course, we have some suggesting information that guides us that an inclusive approach is critical to the fight against HPV and associated cancers. Of course, we know that women and men are key players in population sensitization, in advocacy, and in decision-making. And so getting everyone on board is vital in the fight against HPV. For instance, in Cameroon, we introduced the HPV vaccine in 2020 just to adolescent girls. And 3 years after, coverages remain really low, less than 20%. And evaluating the context, we decided to engage men more and to move to gender-neutral vaccination, vaccinating boys and girls. So intensifying communication and the value of vaccinating both targets improved vaccination coverage for girls in Cameroon triple-fold. So we moved from less than 20 to around 60% coverage. And we noticed that the gender-neutral approach directly impacted and significantly impacted vaccine uptake for girls. So we think that the gender-neutral approach is the way forward. Not only have we improved vaccination coverage, but we've also laid the platform to limit the virus spread, the prevalence of the virus in the community, and consequently, that will reduce diseases, cancers that come from this viral infection to both men and women. The challenge remains, we need vaccines to be able to move on, and that is our move to ensure that we protect the entire population. Do it quickly by vaccinating both men and women.
Awesome. And Ibtihal, riding on what Andreas has just said, how does involving men in decision-making help to move the needle? And I want you to excuse the pun. So how does that help, especially in Eastern Mediterranean countries?
Yes, thank you, Karen. Yes, indeed, our observation and experience in the region, we have to focus on include men in the equation because they have a critical role to play in HPV elimination. So first of all, like to reduce the transmission, we need more men awareness, and including from our experience, including religious people in the equation is very important because they have community leader and religious people, they have a tremendous influence on the community. And one of the experience in one country in our region is the messaging is transformed that this is not a sexually transmitted disease, it's a cancer prevention. So when we do awareness about HPV, we are talking about cancer prevention for men and for women. And that worked very well, even in a strictly religious country, to avoid the stigma. Training of policy maker also, because most of the country in our region, the men are taking the lead in terms of the policy formulation, and also they are the lead in a family health decision. So they should be aware about the inclusivity and aware that this is a disease, not a women disease only. It is a man and a women disease. But they need data. And this is why we have, as a government, as a civil society, we engage on developing data and publication of data and engagement in the research to show the impact of the disease and the link between HPV infection and the cancer development. So in addition to the story of awareness, which we are currently working and addressing, also the inclusion, the vaccine, the gender-neutral vaccine. So this is currently only 2 countries are implementing as a national vaccination program, but we are working very closely with many countries to improve the situation and to introduce gender-neutral vaccine so the men will be in the equation. Screening and the uptake of the screening is very low. And here also the men as a family decision maker, they need to know about the importance of supporting their partner to go or their wife to do the screening, regular screening. And that is also part of the awareness agenda, which we are working on for the last few years to improve the screening situation. And I also want to insist on all the time we do smoking cessation. Other society do a smoking cessation program and talking about quit smoking. Also, they put a lot of connection between cancer and smoking, including the effect of cervical cancer and other cancer related. And the research engagement of the men in the research, they will be a critical partner in research, so they will also understand the relation and the need for working on HPV elimination. Over to you. Thank you.
Well, thank you so much. You bring up something that I keep referring to, and that is that for the longest time, I think the messaging has been HPV in relation to cervical cancer. And I think that is what has brought up a lot of stigma and myths and misconception, because I think we neglected to, at the same time, start talking about in relation to other cancers that affect men, such as penile cancer. So maybe if, I don't know how we can do the turnaround quickly so that everyone can come on board and realize that, you know what, this is for everyone and not just for the women. So thank you so very much for that. Question for you, Devanshi, is that although everyone is affected by HPV, which I've just mentioned, the biggest burden is carried by women. Do you have any concerns about unintentionally increasing inequalities and slowing progress toward cervical cancer elimination goals?
So, like a lot of panelists have discussed today, there is quite a bit of a robust body of evidence that supports a gender-neutral HPV vaccination policy. not only for protecting men from HPV-related diseases, but a gender-neutral policy also, doubles the protection for women against cervical cancer. So ideally, such a program would be the most effective approach, and there is quite a bit of data that supports that. However, implementing this in India has posed a few challenges. First, the sheer number of eligible adolescents for vaccination in India, that is children aged 9 to 14, that number is 110 million. To give you some perspective, compare that to Rwanda's corresponding eligible adolescent population. It's 1 million, which means that if you vaccinate those 1 million adolescents in India, you've only covered 1% of our eligible population. And that is actually what our current coverage is, 1%. We're a long ways away from herd immunity. The cheapest available vaccine in India costs about $20 a dose, and that's the indigenously developed vaccine. So, you can do the math there. And lastly, like a lot of people have mentioned, there is a fair amount of stigma around the biology of transmission, HPV transmission, which is really unfortunate because the way I look at it, it's really an everyday part of life kind of organism, very similar to the common cold, except that it's 4 times more contagious. And it does not behave like other STIs. It really does not give any accurate implication about anybody's sexual practices, whatever your views about them might be. So I agree and there's a lot of data that supports this as well, to focus on HPV vaccination more as a cancer prevention vaccination and not an STI prevention vaccination. But there's a lot of social and cultural norm building to do to bring men into the conversation, to the table. And without a well-planned strategy, bringing in male vaccination in India has many times shown to reinforce stigma and set progress back rather than moving it forward. But that's not an excuse. We have to sort of figure out a way to make this happen. So an analogy I used to think about this whole problem is, think about cervical cancer like a looming thunderstorm, and vaccination is our shelter to protect us. Now, ideally, we would build a complete shelter, a structure with roof, walls, doors, and windows. But if our current resources and circumstances are only allowing us to start with the roof, vaccinating girls, then that's where we begin. Meanwhile, we have to continue finding the bricks to build that wall, advocating for and expanding male vaccination wherever incrementally feasible. While gender-neutral policy is the goal in India, I think we have to be pragmatic in India's current reality, where if girls is what we are getting access to, then by all means start there and work towards a more inclusive policy.
Thank you. Thank you so much. Dr. Stanley, we opened our discussion with your perspective on the need to involve everyone if we are going to achieve the elimination of HPV cancers. What is your view on the risk versus benefit to a universal approach to HPV awareness and prevention?
I think the risk is if you don't do it. Because if gender-neutral vaccination doesn't eventually dominate, then we haven't really got the opportunity to remove the virus. So at the moment, there are all these myths and prejudices. This is not a woman's virus infection. It's a virus infection. It goes for everybody. Do you only immunize girls against diphtheria? No. You immunize boys and girls because both boys and girls get the infection and get the disease. And that is exactly the same with HPV. Both men and women develop cancers associated and caused by HPV. So if you're going to prevent that in men and women, you've got to give them the prevention protection, which is the vaccine at the moment. So the challenge of the risk is if we don't do that, we don't get rid of the cancers. They continue killing, they continue causing disaster. Now, men dominate in our society, whether Western and across globally. And so men make the decisions. They're in government. So one of our real challenges is persuading the government, persuading the politicians that this is important. And in most countries, the politicians are men. It's in their self-interest to get involved. That's a pragmatic approach. Men have a real interest. They have an involvement in this. You know, let's pull them in because we're protecting them. So the challenge is to get that message out. The risk is if we don't, we lose a real opportunity to get rid of 5% of all global cancers. That's the challenge and that's the risk, in my opinion. And what I've liked about this webinar is how we see how to do this matters in different cultures, different ways, different approaches. And so, yes, you think globally, but you act locally. Look at the local culture, the local social norms, how the local religion, how the society is organized. Those are crucial in all these programs. But let's not forget the key thing. This is a virus infection. It affects both men and women, however they live. We can't prevent the infection the way we prevent a huge number of other infectious diseases, such as polio. So we don't worry about polio in men or polio in women. We give the vaccine to prevent polio across the population. Please, let's look at HPV in that light, and the fact that we're giving it to prevent a cancer. That again is a key message, is a cancer prevention vaccine. So that's my view of challenges and risks. The risk is we don't do it.
Thank you so much. So from what I take from you is that we have to be culturally sensitive.
Absolutely.
You know, and yes, and just look at what the region, you know, what they do and what is right, what is wrong, so that we don't shoot ourselves in the foot. And that, I think what I like is the big risk is if we don't do it. All right, so before I open for questions, is there anything, and this I'll ask you to be very brief, and I'll ask you, since you're on my screen, Dr. Stanley, just anything that you'd like to add briefly in about 30 seconds before we open for questions. Dr. Margaret, can you hear me?
Yes, sorry. The other
yes.
thing I really should emphasize is that, you know, the people who have to be convinced in terms of vaccination are actually the immunizers who put the needle in your arm, because they're likely to be the nurses or the health visitors in the population. They're trusted. And so you really have to inform and persuade the people doing the prevention how important this is, that they're doing something that's going to save a life, and that it doesn't matter whether it's a boy's arm or a girl's arm, it's going to save a life.
Okay. So instead of having everyone just give me their last thoughts, I would like to go straight to some of the questions that have been posed. And the first one is for Joel, and this one is, why is HPV vaccine only administered to women, yet it affects even men? This is from Felix from Kenya, and I would really ask you to be brief as you respond to these questions.
Sure.
Joel, please.
Thank you. That's a very complicated question, but essentially it's because of the burden of cervical cancer being so important relative to the other cancers, and a number of logistical issues related to limited supply of vaccine and the cost of vaccinating everybody. These are slowly being addressed. Just want to also mention how I appreciated the fact that this discussion covered the very broad role for men in this, because we need to have a dual focus, not only in raising awareness amongst men about the need to get vaccinated to protect themselves, but I think, as so nicely mentioned by Ibtihal, engaging men as allies to protect women who are older, for instance, in cervical cancer screening, given their important role in helping to make decisions about women's healthcare. So we really need men to understand that it's twofold benefit, protecting themselves and protecting the women that they love.
Thank you. I have two questions for Devanshi. And the first one is, I am Dr. Zainab Zubair. I have a query that although the way forward is gender-neutral approach in vaccine advocacy, yet vaccine availability is a big issue, especially in Pakistan. And the next one for you, Devanshi, is how the theory of PEN3 model works for HPV vaccination promotion. This is from Dr. Fariha Hassin from Bangladesh. You may quickly respond to those two.
Right. So I'll go with the second one first. The PEN3 model is what we have used for screening, not so much for vaccination. For vaccination, the social motivation factors are covered under the BEST model. So there's an established model for vaccination, and we stick to that. It's been validated across many different countries and cultures. So we use the BEST model for vaccination, but certainly the PEN3 model can be used in vaccination as well to understand cultural social norms and how that impacts vaccine uptake. Can you repeat the first question? I'm so sorry. I know we're short on time.
Okay, so the first question was a query that although the way forward is gender, I think this is probably a comment. Although he says, I have a query that although the way forward is gender-neutral approach in vaccine advocacy, yet vaccine availability is a big issue, especially in Pakistan.
Right. So there are a lot of new vaccine producing companies that are coming on board, that are getting on the WHO pre-qualified list. India has an indigenous vaccine. There are a lot of vaccine manufacturers in China as well, that are on the WHO list. Then obviously there's Merck with Gardasil and there's Cervax and so on and so forth. I think, as the demand increases right now, at least in India, and I suspect Pakistan is very similar, is that even if we had all the vaccines we needed, we would still need to work on convincing people to take them. So while the supply is building up, at least build the awareness and the demand for it. And then I think the supply will follow.
Thank you so much. The next question is for you, Margaret. And this one says, what are some of your different strategies for informing the adolescents and their parents? Is there a need for different communication to the two groups?
Yes, I think it depends. Again, it depends on the community you're working in. In the UK, we use advertisements, social media, really telling the parents this vaccine's available, it's free, it'll be given in school, and it will protect your daughter and son against cancer. That's the message that goes out. Now, in some countries, they don't have a high level of literacy. So you have to have a different approach, films, cartoons, visual explanations. And so that is very much a question of infrastructure and organization. And you have to get effective implementation, you must link up with those groups who are doing something similar in your country or in your health system, so that you have a global approach to what you're doing. So the answer is keep the information up, make sure they know it's going to work, make sure they know they need it, why they need it, and make sure they understand it's safe. Those are the key messages you give out with vaccination. And make sure your immunizers know all this. That is, again, because they will reassure, they will persuade. So that is critical.
Thank you so much. And I've got a question for you, Mauricio. And it says, how can we expect elimination of HPV in low-income countries that bear the high burden of HIV and disparities in vaccination? Recent data show that 9 out of 10 girls are vaccinated with HPV versus 3 out of 10 in sub-Saharan Africa?
Well, that's that's quite a big question, and I think the goals that I mean WHO has are significant. They're big. I mean, I think when we just say like the 90-70-90 targets, it seems like it's fairly simple, but it's extremely challenging. And I think a lot of this has been addressed through even some questions that are being made about access to the vaccines that we need to ensure that can be provided. In the PAHO region, we have the revolving funds that help us procure HPV vaccines, HPV screening tests for our region, but that's not the case for other regions. So we need to ensure how can we make these technologies more accessible, around the world, specifically in countries that need this the most, right? The ones with a higher HIV burden. And in our region, we don't have such a high burden of HIV, but I think that's one of the biggest challenges. And then the big investment that's required to ensure that not only vaccination can happen, but also screening and all the challenges that HIV populations have, having that higher prevalence of HPV, and how do we follow up and treat all those women? So I think there's significant barriers on access that need to be overcome to do that. And that's something that needs to be worked, and it's currently being worked, to ensure that everyone can have access to the technologies, vaccination, screening, and treatment.
I think I might be able to contribute something here, because there is ongoing a study in South Africa looking at the impact of HPV vaccination in girls who are HIV positive compared to girls who are HIV negative. And the information is very early days, and not big numbers, is that there's no difference in terms of the impact on reducing HPV infection in HPV, HIV infected versus HIV negative girls. And that's really important, because it means that we can give the vaccine with safety to this group of girls who are immunocompromised. But again, it's early days, and we have to be cautious. But I was one of the big cynics about all this, so I'm quite pleased by this information.
Thank you so much. And for you, Joel, are there any studies done to see the effect of HPV vaccine in prevention of HPV-related cancers affecting humans in areas other than cervix, e.g. head and neck cancers, uterine cancers?
So there is good data, for instance, showing protection in women for other genital cancers, such as vulvar cancer, vaginal cancer, at least in terms of prevention of infection at those sites, and high-grade precancers, direct evidence of prevention of cervical cancer. For the cancers that also affect men, penile cancer, anal cancer, head and neck cancer, it's a little bit of a different story. There's direct evidence showing efficacy of vaccination to prevent anal HPV infection and high-grade precancers. We don't yet have direct evidence of prevention of anal cancer because it takes time. We expect fully that it will prevent anal cancer. There are a lack of prospective randomized controlled trials for penile cancer, but for the portion of cancers in the penis that are associated with HPV, we're very, very optimistic that it will protect against those. And then for head and neck cancer, it's a similar story. Not all of them are associated with HPV. We don't yet have direct evidence of protection for HPV-related head and neck cancers, but there's some indirect evidence, such as observational studies showing that amongst women and men vaccinated against HPV for other studies, that there's actually reduction in acquisition of oral HPV infection. So a lot of indirect evidence leads us to believe that for HPV-related cancers outside the anogenital region and penis and anus, that the vaccine will be effective.
Thank you so much. I have one last question before we close, and this one is for Ibtihal. Is there any danger for over HPV self-sampling, like hurting fertility? Is it another misinformation or a fact?
I think it's also, this is a misinformation, because we are here in our region, we have many discussion now trying to promote self-sampling as a way or a measure to improve the uptake of the screening. Still, there is a lot of discussion and there is a lot of limitation, because most of the country now, even in a high resources country in our region, still they are using, you know, the traditional measures for the cervical cancer screening, the VIR and pap sampling. So to move into self-sampling, we need another technique that has to be introduced. And still we are very much encouraged and optimistic to introduce this means in our region. Especially it is also very much in line with the cultural attitude. You know, women prefer to do the sampling by themselves rather than going to the clinic and do the sampling by a healthcare provider in the clinic. So to respond, no, it is not right. This is a misinformation. And the way we are encouraging self-sampling, it will be the way forward for improving the screening uptake.
Thank you so very much. And we've come to the end of the webinar. Before we do, just a few takeaways here is that the first one is that the HPV is going to prevent infection for both men and women for different cancers. And therefore, we all need the HPV vaccine because it works and it is safe. It's also very important for us to engage men in our messaging because they're not just important for the policy. We also have to be culturally sensitive depending on the areas that we're working in at the particular time. And another thing for me that stood out is that we need to include healthcare workers in the awareness campaigns because, yes, we take it for granted that that is their field, so they should know about HPV. In most cases, they have very limited knowledge, so we need to increase their awareness. And also that the big risk is we have to do it because if we don't, then we're going to lose a lot of people. So at this point, I'm going to just say thank you very much, and I'll hand over to Joel to just close us. Thank you.
Thank you so much, Karen. Thank you to you for moderating this session, and thank you to our panelists for what I thought was a really important and interesting discussion. Happy International HPV Awareness Day to everybody, and thank you all, and have a wonderful whatever remains of your day.